Anaplasma, 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 order Rickettsiales, genus Anaplasma. Anaplasma species appear as small 0.2 to 0.5 micrometer in diameter, round dark red body with no cytoplasm and with a light halo may be found around them inside the erythrocyte. One erythrocyte may occasionally have more than one organism. Genus Anaplasma, species, definitive host, location, transmission or vector. Anaplasma marginally cattle, usually near the margin of RBC. Various species optics fly contaminated surgical instruments. Anaplasma centrally cattle in the center of RBC. Anaplasma ovis, sheep and goat RBC. Anaplasma marginale. Anaplasma marginale. Anaplasma marginally found on or near the margin of erythrocyte in stained blood films. Anaplasma marginals transmission transmitted through various species of ticks, transovarian transmission, biting, fly and even mosquito. Mechanical transmission help in transmission of anaplasmosis. Anaplasma marginally transmission disease can also be transmitted mechanically by infected blood contaminating the hypodermic needle used in mass vaccination and castration, ear tagging and dehorning instrument. Source of infection is always the blood of an infected animal. Life cycle of a marginally Anaplasma marginally disease, anaplasmosis or gall sickness. Pathogenesis. Anaplasmosis is a disease of adult cattle and clinical anaplasmosis is mostly seen in cattle about 18 months of age. Younger animals are susceptible to infection but clinical symptoms do not occur. Anaplasma marginally pathogenesis. Anaplasma organism infected erythrocyte are engulfed erythrocytophagocytosis by the cell of reticuloendothelial system, spleen and bone marrow and cause extravascular hemolysis leading to anemia. Anaplasma marginally symptoms fever, anorexia, anemia, jaundice and maybe abortion in pregnant cow. Anaplasma marginally diagnosis on the basis of symptoms. Microscopic examination of stained blood smear revealed round and dark red body inside the erythrocyte. Anaplasma marginally treatment. Oxytetracycline 6 to 10 mg per kg body weight IM is drug of choice in treatment of anaplasmosis. MVAC and anaplas vaccine have been prepared against Anaplasma marginale. Genus Ehrlichia. Genus Ehrlichia. Genus Ehrlichia. Species of Ehrlichia occur inside the white blood cell of variety of mammals, either slide or in group called morula. Important species are Ehrlichia, Ehrlichia bovis in cattle, E. canis in dog, E. equi in horse, E. ovina in sheep, E. phagocytophilia in cattle, sheep and goat. These species are transmitted by ticks. Dog. Ehrlichia canis occurs in India. The disease caused by species is called canine ehrlichiosis or tropical canine pancytopenia. The organisms are found inside monocyte. In acute form, there is fever, severe anemia, and thrombocytopenia. The disease may become fetal. Rhipicephalus sanguineus transmit the organism. E. canis is commonly found in mixed infection with Babesia canis in dog of goat dogs in India. Canine ehrlichiosis. It is tick-borne potentially fetal rickettsial disease in dogs, mainly caused by Ehrlichia canis. Recently, another species, E. platy and granulocytic Ehrlichia have been recorded. The disease occurs in acute, subacute, and chronic phase with a wide variety of inconsistent manifestation. Concurrent infection are frequently seen with species of Babesia, Heptozoon, Leishmania, Tyrophilaria, etc. Pathogenesis. During acute phase lasting 2 to 4 weeks, the organism enters the bloodstream and lymphocyte and localize on macrophage of RES in spleen, liver and lymph nodes. Later infected cell is spread to microvasculature of lung, kidney, eye and meninges. During initial acute phase, there is thrombocytopenia that is attributed to immunopathological mechanism. Disseminated intravascular coagulopathy may occur due to vasculitis and endothelial damage. Leukopenia seems related to increased destruction of leukocytes. In subclinical phase, there is thrombocytopenia, leukopenia, and anemia. In chronic phase, there is hypergammaglobulinemia that seen to be due to secondary autoimmune response to damaged host cell component. Clinical signs through consist appear 1-3 weeks after the infection and disappear within 2-4 weeks. Mild depression, anorexia, leathery fever, mild loss in body weight, lymphadenopathy, and splenomegaly characterize acute phase. Besides, there may be ocular signs including conjunctivitis and anterior uveitis, vomiting, palimucosa, peripheral edema of the hind limb, and scrotum hematuria, intestinal pneumonia, arthritis, and some neurological symptoms. Diagnosis. It is difficult due to vague and non-specific clinical manifestation. Confirmatory diagnosis of ehrlichiosis depend on detection of E. canis moruli within monocytes and lymphocytes in peripheral blood smear in field condition. Capillary blood smear prepared from blood collected from the ear tip of the dog is preferred. Nevertheless, diagnosis in field cases can be based on Buffy code, lymph node, or bone marrow cytology. For studying prevalence of the disease in a particular area, detection of antibody by IFAT is relied upon. Treatment. See table 6 on chapter 9. Blood transfusion and vitamin B complex hasten the recovery. Prevention is possible by treatment of infected dogs and control of tick population. There is no lasting immunity in E. canis infection following treatment. Thank you.